All right, guys, welcome back to Boots and Boards and our emphasis on shock. So next shock we're going to talk about is hypovolemic shock. Now, remember, shock is that hypoperfusion state, not getting enough blood flow to the organs or to the tissues. This one is due to volume loss. So these are the patients you're thinking about who are coming in after a trauma, who are hemorrhaging, so they're losing all of their blood. Or a common one you'll see is a patient who's coming in with vomiting and diarrhea. So they're losing more than they're able to have intake. And so this is where you're going to see the hypovolemia, the volume loss leading to shock. So how these patients present is cold, clammy skin, okay? Because they're not having enough volume, their body responds by going to increase in their systemic vascular pressure. So the body's trying to squeeze all of that, as much of the volume as it can, to get to the tissues, to get to the organs. And so it raises your systemic vascular pressure. The other thing you're really going to see is a drop in cardiac output. Now, remember, cardiac output is heart rate times stroke volume. Here, your heart rate's trying to compensate by going up, like in all shock states. But in this one, you have a drop in your stroke volume because you're having not enough volume. So you have a drop in your cardiac output. You're going to see a drop in your central vascular pressure. Central vascular pressure is the amount of volume that is your preload, or the amount of volume that's coming right into the right side of the heart. Because you don't have enough volume, you're going to see a drop in that pressure in that preload. You're also going to see a drop in your pulmonary capillary wedge pressure. Again, that's the measure of the amount of volume coming into the left side of the heart. So overall, you're going to see drops in all of these kind of major factors. Only thing that you're going to see an increase in is your systemic vascular pressure. And again, that causes a resultant in cold, clammy skin presentation.